Hi, my name's Ian Taylor, and this is the story of what's happened to me over the last 2 months in relation to prostate cancer. Been fitting well and having very few symptoms at all. Being a nurse of 41 years, just an urgency to pass urine now and again. I spoke to my GP. We sent some urine off to test for the urine infection. That came back negative. This followed a consultation with my GP, who ran some bloods and did a blood test, what they call a PSA test, prostate specific antigen test, which came back raised slightly, not a lot, but it was raised, 6.8. I was invited in to see my GP for a digital rectal exam, which is a very quick, painless examination of the prostate, which showed that it was slightly raised. And to my amazement, he said that he'd fast-tracked me for query prostate cancer. Fit and well, not feeling ill. I was shocked. The referral went off. And we all within a month, which was amazing, from speaking to my GP. The next stage was to have an MRI, a specialist MRI scan of my prostate. Again, painless, not a problem. The results came back quickly, showed priads 4 and 5 in 2 areas of my prostate, which was highly suspicious of cancer. Following this, I had a biopsy at New Cross Hospital. Again, painless, not comfortable, but painless, and dignity preserved at all time, very professional. And the results of that came back yesterday, which showed that I'd got cancer of the prostate. Luckily for myself, it's been caught very early. It's a group 1 cancer, Gleason score of 6, which is the lowest cancer score that you can get with prostate cancer. And now I'm able to watch and wait and choose from treatments if that's deemed necessary. So, following this experience, I run 31 miles for prostate cancer research, ended up running 124 miles in March, raised £3,720 for prostate cancer research, and has become on a mission really in relation to spreading the word of prostate cancer and its stats. What surprised me, being a nurse of 41 years, I didn't realise that prostate cancer actually is the most common cancer in men. There's no national screening programme for this, not like bowel cancer, where it's sent poo through the post, females cervical screening, breast screening, but the most common cancer in men, no national screening programme. At the age of 50, you are in the high risk bracket, whether you like it or not. 50, you're high risk of prostate cancer. Afro-Caribbean descent, it's 45. So 1 in 8 men will get this cancer. 1 in 8 men, and 1 in 4 Afro-Caribbeans. That's huge. And there's no screening programme. There's no symptoms usually. My symptoms were very mild. And if I had not been a nurse, I'd have probably put that down to just my age and probably ignored it really. So this cancer has no symptoms often. When you get symptoms, the illness, the disease is more advanced. Unfortunately, once the cancer metastasizes, comes outside of the prostate, then that's a different kettle of fish treatment-wise and prognosis-wise. But if you catch this disease early, but it's still contained in the prostate, then this is really treatable. So early detection equals early treatment equals better outcomes, yeah, and less invasive treatments. So just urge, and this is my message, finding this out, speaking to people. I've spoken to that many people. The prostate cancer has touched their lives. And this leads on to another issue, that if your dad or your brother had prostate cancer, you're twice as likely to get this cancer, twice as likely. If your mother had the brachial breast cancer gene, that's linked as well. So all these things are really, really important. A simple blood test, PSA, which you can get from your GP, will start the ball rolling. It's not a brilliant test. It's not 100% accurate, but it will lead to discussion with your GP. If you have symptoms, urgency to pass urine, passing urine then stopping and you can't empty your bladder, urinating a lot more than you normally would do, any discomforts in your lower abdomen, then it's worth speaking, not just putting these symptoms down to age. Speak to your practice nurse, speak to your GP, have a conversation about it. What I've learned from this is that throughout my journey over the last 2 months, I've spoken to people about it. I've done videos while I was running, and I've been open about possibly having prostate cancer. This has led to me talking to lots of people about their experiences, their fathers, their brothers, and their experience with prostate cancer. And it's just amazing how many people are affected by this illness. You know, men are not very good. You know, women tend to go and are probed and investigated a lot more than men, especially having children, you know, cervical smears. Men are not used to it, and I've found, quite shockingly, a lot of men are really panicky about having the digital rectal exam. It's unbelievable that, you know, something like this that can save your life. Yeah, I'd worry about having the cancer, not the investigations. And hopefully, if you're investigated, it'll rule everything out. But if it is cancer, it's one of the ones that's very, very treatable, as long as you catch this early. If you catch it early, there's a high 98% survival rate. So I just urge people, you know, I'd urge daughters and wives who have a lot of influence over the men to encourage them to, if they have symptoms, if they're over 50, just have a discussion with the GP about a PSA test. So that's my story, really, and I just want to spread the word further so that men in general have the information which will give them informed choice about seeking advice of a medical professional about this condition. 1 in 8 men, 1 in 4 Afro-Caribbean men. 52,000 new cases every year, and that's set to double. And 12,000 deaths from prostate cancer, which could be avoided. The government has just put 42 million into a programme, I think it's called Transform, which is looking at better ways of screening, diagnosis and detection of prostate cancer. So hopefully in the near future we will have a national screening programme for this disease. So there's a lot of good stuff happening, and I think the more you can talk about it, the more you can spread the word, the more awareness there is that not to leave something because you think it's something or nothing. Talk to somebody about it. It helps. Anyway, I hope that's been useful. I hope you know, you'll spread the word about how common this cancer is to your male friends and relatives. Thanks for listening. Cheers.